Good afternoon, Mr. Chair and members. My name is Cesar Lopez. I am the Associate General Counsel at the Texas Hospital Association, and I'm here this afternoon to respectfully oppose HB 396 as currently drafted. First off, I want to thank Representative Moody and his staff for meeting with us and trying to address some of the concerns that we raised on this bill. Again, I realize that this is probably an unpopular position to take on this issue, but I want to be clear that we want to do right by all of our healthcare workers on these issues. We know that the last year has been very difficult for everybody within the hospital, within our facilities, within our hospitals. We do appreciate all of our healthcare workers, and we certainly do want to honor and cover any of these claims where an individual did contract COVID-19 through no fault of their own. And there certainly are situations where that occurs, whether it's a failure of the PPE, let's say a strap breaks, a mask falls off, or you have an aggressive patient that might pull somebody's a healthcare worker's mask off of them. There are certainly situations where there is a valid claim for these workers' comp benefits. Our concern really is that this bill just goes too far. Again, we want to just try to find the proper balance here. We want to continue to work with Representative Moody and his staff to try to find that balance. We are committed to finding that balance, and again, not necessarily opposed to some reformation of the process here. We just, again, think that this bill goes too far. We do have a duty to try to get this right. We're excited to hear that there is a substitute bill on the way. We're happy to take a look at that and hope that we can continue these discussions and address some of these concerns. With that, I want to thank you all for having me this afternoon, and happy to take any questions.
Thank you. So, what would a typical nurse's work week look like in a typical Texas hospital over the last year?
Well, over the last year, I think it would vary from facility to facility, but
we're talking 40 hours a week, or?
Probably, I would imagine so, yes. I mean, I couldn't say with any certainty. I would be speaking in very general terms, but yes, I believe that's probably right.
So even with the crushing patient load that, I mean, we've seen a lot of stories about people working exceedingly long hours, with days on end with no day off, sometimes weeks on end with no day off. I mean, are they working 40 hours a week, or are they working 60, 70, 80, 100 hours a week? Is that possible?
Again, Mr. Chair, I think that's certainly possible. There's nurses, physicians, basically anybody that's working in a hospital may have been called on to work those extra hours, especially as I think the staffing shortages that have been discussed are well documented as well. So again, we're all trying to do the best that we can.
Absolutely.
In the circumstances.
I'll say, I mean, our hospitals, administrators, doctors, nurses, support staff have done amazing, heroic work over the last year. We all agree on that. My point of me asking that question, though, is, I mean, if nurses working 80 hours a week, weeks on end, caring for COVID patients, how do you, and they get COVID, how do you say with any degree of certitude at all that, no, we don't think this is work-related?
Again, I don't know that we would go that far. What I'm concerned with, what our members are concerned with, is when an investigation is done on these claims and there is some evidence out there that that individual, again, I don't want to just limit this to nurses, but that individual maybe didn't follow the policies and procedures, was seen maskless. We've actually heard, again, anecdotal stories, but stories of individuals saying, I'm not going to wear a mask today, and they go into a patient room without any PPE on, or they're congregating in groups, maskless, conversing, things of that nature. Again, I know that's a lot to ask of folks, but in the midst of a pandemic, if folks really are concerned with contracting this disease, these policies and procedures are in place.
That'd be sure. I think that's a legitimate point. I would assume most healthcare professionals, though, are not doing that.
Correct.
Is it fair to say that's a few and far between type of situation?
Granted, I would argue that the vast majority of healthcare professionals, and maybe I'm stepping too far here, have not contracted COVID-19 in large part, if not entirely, because they are following the policies and procedures put in place to protect everybody.
Members? Yes, Representative Shine.
Mr. Lopez, from your experience, what kind of policies, procedures do you see across the board on dealing with infectious diseases in general?
Well, certainly with regard to COVID-19, there were a number of regulations that came out, not only on the state, federal, but also the local level. For example,
hospitals adopt those pretty readily?
we took every precaution that we reasonably could to protect everybody within the hospital. That includes HHSC's emergency rule to screen everybody at the door, to require everybody to wear a mask, to wear proper PPE. Certainly, as the year went on, some of those policies and procedures were kind of fine-tuned as we learned more about the disease. But again, I think if you go back to a year ago, we tried to do everything we could to prevent exposure, to keep folks from getting ill, to keep folks from having to miss work. And then again, as we learn more about the disease, some of those policies and procedures may have changed.
From your association and maybe from the individual hospitals, is there a method of tracking the exposure in the workforce, either somehow, and do you aggregate that at your level? Do you determine that between large regional facilities versus small rural facilities?
We at THA do not keep track of a running track of any sort of this, but I'm almost certain that all of our members do. And so if we need to get that information.
Individually?
Yes, sir.
Okay. So based on what we're looking at with this legislation, you have a nurse that goes into a patient's room and they're masked and everything else, and suddenly something happens and that medical professional is exposed because of no fault of their own, but let's say the mask is pulled off, comes off, or whatever. What is the policy?
So with regard to workers' comp or just in general?
Well, both. In general, and then as far as workers' comp.
So again, the specific policy for each facility is going to vary. I would say that maybe most of our facilities, at least initially, when there was a confirmed exposure to COVID-19, an individual that was COVID-19 positive, that person was sent home to quarantine. Many times they were still paid for that time off. Again, I'm speaking in general terms. We have almost 500 members, so I'm not going to account for every single one of those. But again, as we really worked off the CDC guidance, so as that CDC guidance evolved, and there were some kind of tweaks to that, I think there was a point in there where somebody that had been exposed but was asymptomatic or maybe never fell ill from COVID-19 was still allowed to come in and work and treat COVID patients specifically. Something like that, a policy or procedure like that may have been put in place to allow them to continue to work. With regard to workers' comp, again, that's going to be on an individual facility basis. But as I mentioned, if it is a situation where it's clear that that was the exposure, I would imagine that claim would be honored. And I will represent to this committee that our hospitals are, in fact, honoring at least some of these claims, maybe many of these claims. I don't know the exact percentage, but this isn't a situation where we're just denying claims outright.
It just seems like if a medical professional, nurse, is exposed and by no fault of their own in a situation, however it could occur, that they should not have to use sick leave or time or their own time or anything like that, where workers' comp should kick in and provide the coverage for them. But what I'm hearing you say, you're not really certain that there's any kind of uniform policy or procedures in that regards. Is that right?
What I am saying, Representative, is if there's a situation, as you described, where through no fault of their own, there is that exposure, I would tend to agree that I would agree with you. What I'm also saying is that if in that investigation, it is shown that there was some other serious potential for exposure, maybe outside of the hospital, maybe within the hospital, but we go back and we do that contact tracing, we figure out, we start asking questions and we figure out that there was some other event where that individual may have been exposed or was likely exposed. Those are the situations we're concerned about.
Do you know what the breakdown is in your hospitals and your association that subscribe to workers' comp versus those that don't?
No, sir, I do not.
There is a difference.
Yes, sir, there is, absolutely.
Isn't there?
Absolutely.
Some do and some don't.
Absolutely, correct.
Is that information obtainable?
I can find out.
I'd like to know if it is, and then number two, I'd like to know if there's a disparity in that regards versus your rural hospitals versus your more regional or urban centers. Just for information to, because as we're investigating this and looking at this, and this is important to medical care professionals, of what, I guess, what kind of environment they're involved in, okay? Because there may be other things that might need to be considered in addition to the legislation that Representative Moody has. Okay. Thank
Yes,
you,
sir. Yes, sir.
Members, other questions? All right. Thank you for
Thank you. I appreciate it.